What's up guys, Dr. Sina here, and today we're talking about carpal tunnel syndrome. So a lot of people get diagnosed with carpal tunnel syndrome when in fact they have something totally different going on. So carpal tunnel syndrome is numbness, tingling, and pain in these three fingers of the hand or in this region of the hand. Now, there's a lot of reasons why you could have numbness and tingling in your fingers, and when you go get your physical exam and get checked out, you can be quickly diagnosed with it without actually having that issue. Let's talk about a little bit of the anatomy first so you guys can understand where the nerves come from that go into your carpal tunnel, which is right here, and how you might be experiencing some of those symptoms. So all of the nerves that supply your shoulder and arm come from your neck. So on their way out of the neck, they pass through a lot of deep structures. So there's lots of muscles in this area. Then the nerve travels underneath your collarbone, under your pec muscle, here into the armpit. And it comes along down your bicep into the elbow. Here it passes through a bunch of other muscles through the forearm. Then this is the actual carpal tunnel here. See how it looks like a tunnel? From here it goes through into your thumb, index, and middle finger. So basically, anywhere along this path, this nerve can get stuck. It could get stuck under tight muscles. If you have a little bit of like degeneration here or arthritis, it can get stuck under your pec muscle. It can get stuck between the biceps and the forearm. The only time it's truly carpal tunnel is if it's stuck. So carpal tunnel syndrome, guys, is if it's stuck here. So basically this tunnel, which is called the carpal tunnel, has a cover. If there's too much friction from repetitive overuse of the wrist, the nerve goes through a process of inflammation and healing over and over again, and it ends up thickening. Once it thickens, it doesn't fit inside of this tunnel anymore, and you start to have numbness, tingling, and pain in your thumb, index finger, and middle finger. So before we jump to the conclusion of is it carpal tunnel syndrome, we have to do some tests. So the first test that we do is to just tap on top of the carpal tunnel and see if we get any shooting electric pain or numbness into these fingers. The other one is you put your elbows on the table and you just let your wrists hang like this. If after a few seconds you start to experience that pain in this finger, and this finger, then you might be having carpal tunnel. So to confirm the diagnosis, what we do is we send you for a nerve conduction study. They check with a special probe to see if the nerves are conducting the electrical signals properly or not. And then you get your diagnosis. So let's say you're not diagnosed with carpal tunnel, then what are you supposed to do? So what we do here is we go along the entire path of the nerve, all the way from the neck, through the chest and collarbone, down the inside of the bicep, into the elbow and the hand, and we find locations where the nerve could basically just be stuck on a muscle or something. Then what we'll do is we release it all the way. We might even do a little bit of acupuncture just to speed up the healing process, and usually within a couple treatments you're good to go. So guys, before you jump into getting surgery done or anything like that, it's always a good idea to get this checked out, get a couple of treatments and see if that helps first. All right guys, so now that we talked a little bit about diagnosing carpal tunnel and how to tell if it's true carpal tunnel syndrome, I'm going to tell you who's at risk for it. So basically anybody who does a lot of wrist heavy repetitive activity. So that could be anything that requires flexion of the wrist or typing a lot, let's say hammering, activities that just generally require repetitive wrist movement for prolonged periods of time throughout the day, and things that you do every day. So what happens is over time, this friction on the nerve causes thickening of the nerve again. The nerve runs out of space and then it gets compression. That compression will then cause pain down into the arm. So the other, let's say phantom carpal tunnel, which is basically acts like carpal tunnel syndrome, but it is not the exact diagnosis, which is the entrapment in all the other areas that I talked about. That is usually people who sit at a desk all day or just have a sedentary job where they end up slouched over with their arms on a desk doing work like this. So it could be somebody who paints, let's say a receptionist, a student, somebody who works at a computer. Those types of people are usually the ones that get diagnosed with carpal tunnel syndrome and then end up getting the surgery. After the surgery, the pain is still there because usually the cause was either up here or somewhere before the wrist. So guys, if you have any questions, leave them down in the comments below. If you like the content, subscribe and share our channel with your friends. Take care. See you in the next one.